let's finish up this PowerPoint talking about my favorite, just because it's really gross, topic, all the parasitic helminths. Now, all the parasitic helminths are grouped into 3 different groups, and the parasitic helminths are macroscopic multicellular eukaryotic worms. So we're going to talk about the gross worms that can infect humans. Now, this is usually when one student's like, this is microbiology. Why are we talking about macroscopic organisms? Well, the main reason is because the eggs, which are the infective stage, and even the larvae, which can be the infective stage for many, are microscopic. By the time they get to an adult worm, then we can visually see them and they're macroscopic. But those infective forms are microscopic. Now, most of these have very complex life cycles. They can go through multiple intermediate hosts. Some of the adult stages are dioecious worms, which means there are female worms and there are male worms. And some of them are monoecious, which means one worm that has both sex organs in it. The immune response to any type of parasitic worm infection, we're always going to see an increase in antibody E, and we're also going to see an increase in your white blood cell, the eosinophils, that are trying to attack those parasitic worms. Now, as I said before on the last slide, there are 3 groups of helminths, and so we're going to talk about them based on their groups. We're going to talk about the cestodes, which are the tapeworms, the tremectoads, which are the flukes, and we're going to talk about nematodes, which are the roundworms. Now, again, as I've said with lots of other units, we're only going over some of the top, most common worms out there. There are so many other parasitic worms that we are not going to talk about, but we're going to go over some of the most common ones. And we're going to first start talking with the cestodes, or the tapeworms. Now, tapeworms, they are flat and long, so it's where they get their name from, that it looks like a long piece of skinny, flat tape. They are segmented, so they come in all of these little tiny segments called proglottids. They lack a digestive system. There is no mouth, there is no anus. They get all of their nutrients through their skin. And they all have the same general body plan. They have a head called the scolex, and in the scolex, you're usually going to have some type of attachment organ. It's going to have hooks, it's going to have suckers. This one has both hooks and suckers, but it's going to need some type of attachment structure so it can attach itself to our intestines. They like to live in the intestines, and it's going to have the proglottids, all of those little tiny segments. A strobola is just a chain of segments. Now, again, there is no mouth, there is no anus. I'm like, there's just an attachment area, and then it's all the little segments. Now, the generalized life cycle of a lot of tapeworms, again, some can vary amongst different tapeworms, is we're always going to start off with, we eat most of them undercooked meat. So we're going to eat undercooked meat. We're just going to start there. The tapeworm gets in our body. This big, huge, long thing is going to be in your intestinal tract. And each one of these segments, each strobola, has both male and female parts to it. And each one can shed 100,000 eggs a day. Each one times all of these different segments. And depending on the tapeworm, it can vary how many segments an average tapeworm has, but it can have between 1 and 2,000 proglottids times 100,000 eggs. It's a lot of eggs. All right, so you ate some undercooked meat, tapeworms in your intestine, though your intestines are shedding eggs nonstop in your fecal matter. That fecal matter didn't get processed properly with a water waste treatment facility, and that fecal matter gets ingested by some other animal. As they ingest the eggs hatch into larvae, and they develop in the muscle. Then again, it starts all over. We ate the muscle, we ate the undercooked meat, and it starts all over again. That's the basic life cycle of a tapeworm. Again, basic. There are some variations with different tapeworms. Now, one common tapeworm are the tapeworm that's in the Taenia genus, and we have the Taenia saginata and the Taenia solium. They're more commonly known as the beef tapeworm and the pork tapeworm because their intermediate hosts, how we pick them up, are cattle and pigs. So when we eat undercooked beef or we eat undercooked pork, it puts us at a higher risk of picking up this particular tapeworm. Those that are at the highest risk are usually those that work with livestock, just because they're exposed to it more often, and especially if there is inadequate sewage treatment, meaning those cattle and those pigs have access to contaminated fecal matter that has the eggs in it. Now, when you eat undercooked meat and that egg gets into the intestinal tract, the egg will hatch and it will develop into the long tapeworm. As it attaches itself, you can't even see that scolex area, it attaches itself into our small intestine. Now, for a lot of individuals, asymptomatic, which means you could have a tapeworm and you have no idea. However, as that tapeworm is living in you, it is shedding some of the segments. All of the segments, I'm going to go back to my big picture, all of the segments come from the scolex. So if you lose a few segments, more segments just get made near that head, that scolex region. Now, but as some of the proglottids, some of the strobilus sections can come off, the question is, well, how do you know if you have a tapeworm infection? Well, everyone's like, you lose weight. Not always. Again, they do absorb nutrients in the small intestine, but they also produce waste product as well, which still has nutrients in it that are still part of our small intestine. You may look in the toilet and you might actually see some of the shed segments. You can always take a gander next time. But the number one reason usually people figure out they have a tapeworm is they do go to the bathroom one day and they look down and they've got a little dangler hanging there. Now, you may feel like the first reaction would be to scream, but that would notify other people of your kind of gross situation. But you have a tapeworm infection, and although your next reaction might be to, I'll pull it out, the problem is that scolex area with those hooks or the suckers or hooks and suction cups, that's not coming out if you pull it out. You'll end up ripping off some of these strobila. But as long as that scolex is there, it's just going to keep making more segments. So we do have drugs that can treat it that will ultimately kill the tapeworm, but you still have to defecate them all out. So, next time, take a gander. Maybe you'll see something. Now, if someone gets enough tapeworms in their intestinal tract, it could cause a full intestinal blockage. Now, some ways to prevent getting a tapeworm: cook your meat all the way. There are times you can actually see some of the larvae in the meat that you eat. Now, if you cook it all the way, these aren't going to do a thing. Just make sure you cook it all the way. I usually have individuals, if they see this, they're like, never eaten it, not even going to try it. But just because you see larvae in meat, it doesn't mean it's the larva of a tapeworm that would even grow in a human. Some of these tapeworms and some of the larvae that can be found in different animals are extremely species specific, that you could eat larvae of different tapeworms, but it's not meant for humans, so it will never grow, it will never develop. Just cook your food all the way and you're going to be fine. Now, they did used to think that tapeworms did cause weight loss, that you could actually buy tapeworm eggs as a weight loss tool. Not effective and it's gross, but they did used to market tapeworm eggs as a weight loss tool. I did find this somewhere too, because although we talk about beef and pork tapeworms, there can be tapeworms in undercooked or non-cooked fish as well. Again, we're only going over some of the top tapeworms and the top worms, but there are so many out there. So sushi lovers, just know, it does put you at a higher risk, especially if it is fish that comes from the wild. Fish that come from hatcheries, pretty low risk. Fish that come from the wild, oh yeah, definitely at risk for a tapeworm. Another tapeworm that can cause problems for humans is an Echinococcus granulosus. It's a canine tapeworm. It's a dog tapeworm. This life cycle is with a dog and with an herbivore. So usually like a rabbit or a squirrel, some type of herbivore. And dogs pick up this tapeworm because they eat those herbivores. They eat the undercooked meat when they catch a rabbit and eat it, or catch a squirrel and eat it. Now, humans are accidental intermediate hosts. We're not final hosts, which means it's not going to develop into a full tapeworm in us, but the larva is going to sit there and sit in us. It can get into various parts of our body, waiting to complete the final life cycle. Now, we can accidentally pick up contaminated eggs by drinking contaminated water, eating contaminated food, and this is all food or water that's been contaminated with dog feces. Again, if you have a dog, this puts you at a higher risk. Now, when the eggs get into our body, you ate dog feces, and that egg gets into the body, the larva will develop and they'll get into the circulatory system. And the larva can travel around through our bloodstream and end up anywhere in the body that the blood goes. What it will do then is eventually that larva is going to stop somewhere in the body, and it's going to develop into a cyst. So the larva is going to form a protective cyst around it, and it's going to anchor itself there, waiting to continue on to the final life cycle. The only way it will continue to the final life cycle to get back to a dog is if the dog ate you. Not likely, so we're accidental intermediate hosts. Now, the problem is we have these cysts that can end up all over the body, and depending on where they end up, they can cause a lot of serious symptoms. The disease is called a hydatid disease. And again, depending on where they can cause a lot of problems. Now, this is showing there's a larva inside that cyst, and I'm like in the eye, removing it. There's some that can end up in the brain. There's a huge one. There's a little tiny larva in the brain just waiting for a dog to eat you. Now, and I'm like, the best job is to not pick up one of these to begin with, because it's not the tapeworm that's going to cause the problem. It's this intermediate larval stage forming a cyst around itself that becomes a problem. Best prevention, good hygiene. Avoid fecal-oral transmission. Make sure you wash your hands after you pick up dog poop. Make sure if you're swimming in rivers where there's lots of dogs or, wild dogs, wild coyotes or wolves even. And I'm like, this particular tapeworm can be found in. And I'm like, don't drink the water. So I'm like, good hygiene and don't eat dog feces and you'll be fine. But it is a tapeworm that still causes humans problems. Now on to our next group of parasitic worms, the Trematodes or the flukes. Now, Trematodes or flukes, they're flat leaf-shaped worms. So they're flat, they're long, skinny, and they lack a digestive tract. They only have one opening, which means anything that goes in the mouth and into the intestines comes right back out the mouth. They're generally always going to have some type of attachment device near the top, like a little sucker or a kind of a suction cup, and they're going to use that to anchor themselves to various parts of the body so they can obtain their nutrients. It's going to be close to the mouth. Now, all of the Trematodes are grouped according to the site in the body that they parasitize, and some of them are named for it, but they're grouped based on the different sites. Now, basic life cycle of a fluke generally is going to involve some water, some type of water, a snail, sometimes a water animal like a fish, but it generally is going to involve some intermediate snail or waterborne organism. Now, we'll start with here is some person had a trematode, a fluke, and the eggs for the trematode from that fluke got shed into the feces or in urine. It can end up in both, ends up into a water supply, and it's going to end up in one of its first intermediate hosts because it can undergo several intermediate hosts. Snails are a big intermediate host for lots of different trematodes, lots of different flukes. From there, it can develop into the next stage, and it can either, one, penetrate our skin if you go swimming in infected water, or it can develop into another stage on some type of vegetation, and we pick it up by eating that vegetation like watercress, or it can get into a fish and end up in the mussel, and you eat undercooked fish, sushi, and you can pick it up that way as well. So there's multiple stages, multiple different ways we can pick it up, but they're always going to be tied to water somehow. Now, the first trematode we're going to talk about is it's one genus, two similar species, the Fasciola hepatica and the Fasciola gigantica. Now, hepatica is because this is also known as the liver fluke. Fasciola gigantica, it's still a liver fluke, it's just a little bit larger. It is technically DNA different than Fasciola hepatica, but they both do the same thing. They are found usually in sheep and cattle worldwide, and we are accidental definitive hosts. So we're a definitive host, which means it can develop into its adult stage in us, but it generally doesn't complete its full life cycle. Once it gets into us, it can usually, that's where the life cycle ends. So we're accidental hosts. It's not what it wants to get in, but it'll live with us. Now, how we pick it up, again, a lot of different ways. We could, ingest one of the stages from aquatic vegetation, watercress, raw veggies. Some of these you can pick up by eating undercooked fish. Once you ingest the intermediate stage, it ends up going, once ingested, that little intermediate stage is going to burrow from the intestine into the liver, and then it's going to grow and mature within several months. Now, there's a reason why it's called Fasciola gigantica. These things can get quite large. They're very visible. This is not microscopic anymore. And because these can grow very large and they end up in the liver, it can cause bile duct obstruction and inflammation, which is usually going to give you all the symptoms from having one of these infections. It can cause abdominal pain, it can cause fever, nausea, vomiting, diarrhea. It can sometimes cause jaundice. So it can cause a lot of issues that would tip you off that something's not going right. Now, see, I'm hoping the audio on this isn't going to work. I found this little video. It's a Spanish video, so I don't care about the audio. But they're actually going in and surgically going to remove one of these flukes. This particular fluke is in the intestines. It's not in the liver, but you can see it in there. It is this white structure that has all of the little black around it. That's the main white, and it's got a little black mottled blackness in there. There's another one. Very large, very visible. Now, if there's anyone listening that's a hunter, they're very excited about this video. I challenge next time you hunt, if you kill a deer, when you field dress it, take a look at the liver. A lot of deer have these very large liver flukes in them. Again, you don't need a microscope. They're very large, they're very visible, and you might see them kind of squirm around a little bit. Again, I'm not going to watch this whole video, but they're going to take their forceps. They accidentally push it in more than they pull it out. But they eventually pull it out. But they're very large flukes. Now, another fluke that's common worldwide is the Sista soma fluke. It's a blood fluke. And so its adult stage likes to hang out in the blood vessels. There are also dioecious blood flukes. The adults have both male worms and female worms. Most of the other flukes are going to be monoecious. They're single sex. This has adult worms, adult female worms, and adult male worms. Now again, it's an extremely common fluke. They say about 150 plus million people every year are treated worldwide, and around 200,000 die. Now, luckily for us, we find these mostly in southern climates. So they're found more in Africa, Asia, South America. And the main reason we don't find it here is the species of snail that's needed as the intermediate host is not found in the United States yet. Whether it will be in the future, not sure. But right now, we don't have this particular snail that's required for an intermediate host. Now, when you have this worm in your body, you have schistosomiasis. It's nicknamed snail fever. And there are 3 species that infect humans, but they all do the same thing. But they are slightly different from each other. Now I've got 3 species of schistosoma, and I have 3 pictures up there. These are all the egg stages of the pictures, and if you notice, the eggs look slightly different from each other, and it's how they distinguish which species it is. One has a little spine that's, about 3/4 of the way back. One has a spine at the end. One is more oval and roundish and has a little curved spine. So they're slightly different from each other. Now, how you pick up a schistosoma? Well, after it leaves the snail, the next intermediate host that it needs to get into, the cercaria, when it leaves the snail and wants to go to the intermediate host, sometimes it finds you by accident. and it will burrow in through the skin. So if you are swimming in contaminated water, you may have one of the intermediate stages of this particular worm swimming through the skin, and it causes inflammation of the skin, more commonly known as swimmer's itch. Again, you've got a worm. Granted, it's tiny, microscopic at that stage, but you've got a worm burrowing in through your skin. Now, after they get in the body, the larvae are going to mature, and they're going to mate in the circulatory system, and they are going to lay their eggs in the blood vessel walls. Some of those eggs are going to eventually travel to the bladder and to the ureters and be eliminated through urinating. Now, if you get enough of these, the eggs could end up in different parts of the body, in different various organs. They can die, they can calcify, they can cause severe tissue damage. If you get enough of these adult worms in your blood vessels, it can cause blockage of blood flow, and it can be a very fatal disease. Again, around 200,000 people a year die of this particular fluke. Now, the way to prevent it, improved sanitation, meaning sewage, that urine and fecal matter that may contain eggs don't end up in water supplies that people might be swimming in. And if there are contaminated water supplies, don't go swimming in it. Lucky for us in the United States, we're fine okay right now. But if you do travel, if you're a person that likes to travel around the world or you ever plan on it, be a little cautious swimming in random places. Now, our last group are the nematodes. These are roundworms. We've got 4 of them that we're going to talk about. Now, the roundworms, they're long cylindrical worms, so they're round, and they look similar to the earthworms that you would find. They taper and narrow at each end, and they do have a complete digestive tract, which means they have a mouth on one side and an anus on the other side. They have a protective outer cuticle so that they can live in our body without damage. And you can find roundworms in almost all vertebrates out there. Now, this particular one, this big old handful, we're going to talk about that one, is one of our first ones. Now, there's different ways that you can pick up a roundworm because they've got different life cycles. Intestinal nematodes, they shed all of their eggs into the intestine itself, and we pick it up by consuming contaminated food or water, aka you eat fecal matter. Some intestinal nematodes, the larvae hatch in the soil, and we pick them up because the larva is going to penetrate and burrow through the skin of the host. Some nematodes insist in muscle tissue, and we pick them up because we consume raw or undercooked meat. And there are some filarial nematodes that mosquitoes transmit. But eventually, its goal is to get to the definitive host where it becomes the adult worm, which is going to be the part or the stage that it can make eggs to keep reinfecting. Yeah, the first one we're going to talk about, which is the picture that guy was holding in his hands, is Ascariasis lumbricoides. Now, we find Ascariasis lumbricoides in more warmer climates. In the United States, you generally only find it in rural southeastern United States. And if you have an infection with this particular worm, you have Ascariasis. It's the most common nematode infection worldwide. We don't have a lot of cases around here because, it likes warmer climates. But there's usually about 1 billion people every year that are infected with this particular organism. It can grow quite large, you can see that by the pictures. It's not uncommon that these could be 13 or 14 inches long for just one worm. And you never have just one worm. Now, how you pick it up? Well, we would ingest the eggs in some type of water or vegetation. Once you eat the eggs, they invade the intestinal wall. They get into the circulatory system, and then they head to the lungs from the circulatory system. And they're going to hang out and grow in the lungs. But they eventually need to get to the small intestine. So the easiest way to get from the lungs to the small intestine, and it's not burrowing, it's when you cough and swallow. So if you cough them up, they end up at the back of your throat, and then you swallow them back down, and they end up in the intestinal tract. So, next time you swallow and it feels a little chunky, there might be something a little more with that, especially if you've traveled. Now, for a lot of individuals, asymptomatic, which means you might not know you have these. However, if you get enough of them, it can cause abdominal pain, nausea, vomiting, and yes, if there's enough, it can cause intestinal obstruction, which can be fatal. Now, prevention, proper sanitation, good hygiene, making sure you're washing your fruits and vegetables, not drinking contaminated water, and you'll be fine. The next nematodes, we talk about them together because they're both the same kind of worm, is the Encyclostoma duodenale. It says it likes to be found in the duodenum, the intestine, and Necator americanus, because it is found predominantly here in the Americas. These are both examples of hookworms. Now they're called that because the end of their tail hooks around, so they always have that permanent little hook shape to the end. Now, hookworms get into the body. How you pick up an infection is the larvae can burrow through the skin. So the larvae are going to hang out in the soil, and they burrow through the skin. Now, once they burrow through the skin, they're going to travel in the bloodstream to the heart. They can travel to the lungs. And as we just went over, to get to the small intestine, you cough and then swallow them back down. And they're going to hang out in the small intestine for years. A good 1 to 2 years, sometimes longer. And they use their mouth area with its jagged teeth to latch onto the small intestine and feed on your blood. They suck blood. Now, on average, they drink about 3 drops of blood a day. Everyone's like, oh, that's not bad. Yeah, but there's never just one. There could be thousands of these. And because they're drinking so much blood, it causes anemia. You're going to be exhausted. You're going to have a low iron count. You're going to look pale. Now, one of the first symptoms that you might have, one of these hookworms, is it's called ground itch. Most of the time, people pick these up when they're walking barefoot because the larva's in their soil. And as the larvae burrow in, your feet are going to get very red, very itchy because you have larvae burrowing in. Which means it's the easiest way of prevention is wear shoes, especially if you know you're going to be walking somewhere that may have fecal matter, that may have had eggs laid on it. Now, this made the news about 1.5 years ago. There was a couple, there's no audio on here except some music sound. I'm going to see if our next nematode that affects a lot of individuals in the United States is the Enterobius vermicularis. It's a pinworm nematode. It's called a pinworm because of its size. It's very small, it's very skinny. So the adult is still very small. It's generally around 1 inch, maybe a little smaller than 1 inch size, but you can still see something that's 1 inch long. And Enterobius vermicularis is most common here in the United States. There is usually around 500 million people worldwide infected and around 400 million here in the 40 million here in the United States. Humans are their only host, so we're not picking it up from any animal, but it ends up getting spread really human to human. Now, some interesting things with this particular pinworm. So this particular worm, we pick it up by ingesting the eggs. They look like these clear football-shaped looked eggs. The eggs will hatch in the intestinal tract into these adult worms, and there are male worms and female worms. But female worms, interesting enough, they come out at night, out of the intestinal tract, and they lay their eggs in right at that anus opening. So one of the main symptoms is intense perianal itching at night. So the worms know when you're sleeping. I'm not sure if it's blood pressure, stress, whatever it is. They know when you're sleeping. They come out at night and they lay their eggs right at that anal opening. Quite gross. Now, for some individuals, asymptomatic, no issues whatsoever. Now, to diagnose this, one, and I might because it's extremely common in kids. So I know this firsthand because, again, I swear when I talk about these things, my kids get these things, is that it was several years ago. My kids were in daycare, and yes, one of them at night was like, it itches right back there. only at night. As someone that knows about this, I was like, no, I knew exactly what was going on. Now, you could take them to the doctor. What they're going to do is they're going to give you something that looks like this clear paddle. It's sticky. It almost has kind of a gluish type material on there. And they're going to say at night, put it right there on the anal opening. What they're trying to look for is they want you to collect some of the eggs. And underneath the microscope, they're going to look like these little football-shaped eggs. Well, you could do that. They're going to charge you a ton of money. You could also take some clear packing tape, buy yourself a $25 microscope from Walmart, and identify them yourself. I knew what was going on, so I knew the symptoms enough. My kids were in daycare. Daycares are dirty. Kids are dirty. I ordered the medicine for it. It is such a common worm infection. You can buy the medicine on Amazon. So I overnighted it, had the medicine by the next day. We were fine. Now, problem is you can keep reinfecting yourself, because anytime a kid itches, if they get eggs on their hands and those eggs end up back in their mouth because they don't wash their hands enough, they can constantly keep reinfecting themselves. So prevention, use good hygiene, washing hands, launder clothing frequently, and then if there is an infection present, other than taking the medicine, is you got to be washing the laundry all the time, making sure the pillowcases are washed. And I'm like, otherwise they're just going to keep reinfecting themselves. Now, one of our last nematodes here, it's Vukeriri bancrofti. It's a filarial nematode. It's spread by mosquitoes, and it's one of these nematodes. There's about 8 nematodes that are spread by mosquitoes. This particular one affects the lymphatic system. It causes a condition called filariasis. Now, it's transmitted by female mosquitoes, and the worm itself can live in the lymphatic system, in the lymphatic vessels for years. Now, during the day, they stay put. However, at night, they'll leave the lymphatic system and go into the circulatory system, but only at night, and usually right at dusk. So the worm stays in the lymphatic system during the day, goes into the circulatory system at night. And there's a reason for that, because what's out at night? Mosquitoes are. So this worm has figured out that if it goes into the circulatory system where the mosquitoes are sucking up blood, it has a higher chance of getting sucked up by a mosquito and can continue on with its life cycle, infecting other individuals. Now again, it hangs out in the lymphatic system, in the lymphatic vessels for years, and usually asymptomatic. However, when it gets to be enough of them, it eventually is damaging your lymphatic vessels. And that's when you end up with a condition known as elephantiasis. Those lymphatic vessels are damaged so much that the lymph can no longer flow through them correctly. The vessels become blocked, and all of your lymphatic lymph accumulates in your lower extremities. The tissue is going to start to harden, and you end up with these really large engorgements of lymph in these lower tissues. I mean, you can Google elephantiasis, and it's always in the lower extremities. It's gravity. It's where lymph is going to go, and it's going to hang out down there. Now, the best way to avoid it, since it is spread by mosquitoes, is to avoid getting bitten by mosquitoes. So making sure you've got your DEET, making sure you've got light-colored clothing, bed nets if you're going to areas where this particular worm is found. And luckily for us, we don't have a lot of cases around here. This is mostly found in tropical regions. So again, if you're ever planning on traveling, and the goal of my class is to not prevent you from traveling, but if you're going to travel, just make sure you've got bed nets, you've got your bug spray, you've got things to try to prevent yourself from getting bitten by mosquitoes. Now, I wanted to talk about one particular nematode that it's not grouped as a super common nematode, but one particular nematode that's not discussed a lot because it's not a really common nematode, but there's a reason why I want to talk about it. It's called Dracunculus medinensis. It causes a condition known as dracunculiasis, or the guinea worm disease. It's picked up if you are walking or swimming or even drinking water that's contaminated with the larval stage. Now, the reason why I talk about it is as it develops into an adult worm, it tries to come out of the body. This is not an intestinal worm. The adult worm wants to come out of the body through the skin. And so we can see it coming out through the skin, but it doesn't come all at once. Just a little bit of it wants to come out at a time. And you can't just yank on it because you'll end up tearing it, and then you're going to have a serious infection that would have to surgically get removed. So what they do, and this is found mostly in Africa and India, is that when it does start to come out, they usually get a little stick and they try to wind up a little bit every day more of this worm till it's completely gone. It's going to be extremely inflamed around that infection site, but they just sit there and wind it up on that little stick. Now, reason why I talk about this is because this particular worm is kind of up for debate on being represented. This should be a very common symbol that a lot of you recognize. And although they're like, oh no, it's a snake around a stick. Well, there's the debate. Is it a snake around a stick, or is it this particular worm that they're winding this particular worm around a stick? So next time you see the symbols, there is a debate. Is it actually snake, or is it this particular nematode that they're winding up around that stick on those images? Now, this is just a nice summary of all the different worms that we went over. Again, the most common worms, not the only ones out there, that can infect humans.